Hello and welcome back to the Biochemistry for Health Sciences channel. In today's video, we shall discuss the effect of hypercalcemia on the kidneys, resulting in symptoms such as frequent urination and thirst. In the previous videos, we discussed how moderate to severe hypercalcemia causes lethargy and fatigue by its effect on neurons in the brain, how hypercalcemia leads to muscle weakness due to the effect on motor neurons in the skeletal muscles, as well as constipation and stomach pain due to the effect of hypercalcemia on smooth muscles in the GI tract. In this video, we'll look at the effect of hypercalcemia on the kidneys. So how does hypercalcemia affect the kidneys? In video 9.11 on the milk alkali syndrome, we discussed the effect of calcium on calcium-sensing receptors present in the kidneys. So it might be a good idea, if you've forgotten this, to go back to that video or look at the video at the same time as you go through this video. That will help you understand the effect of hypercalcemia on the kidneys. So one effect of hypercalcemia is in the thick ascending limb of the loop of Henle. So when serum calcium is high, what we see in hypercalcemia, there is a higher probability, because the concentration is high, there's a higher probability of binding these receptors, these calcium sensing receptors. And as we discussed in video 9.11, the binding of calcium to the receptors will lead to the inhibition of NKCC, sodium potassium chloride cotransporter. This is a protein that brings in sodium chloride as well as potassium into the cell, and it relies on this other protein, ROMK, which is also inhibited because ROMK takes this potassium and sends it out into the cavity. So by inhibition of this NKCC, there is a lot of sodium in the cavity that's not reabsorbed, and that forces water to also be excreted by osmosis. And this increased excretion of water will lead to frequent urination as well as thirst. Another effect that we discussed in video 9.11 is the reduced reabsorption of calcium in the TAL. So this decreased calcium reabsorption means more calcium will now enter the rest of the tubule, the distal convoluted tubule, as well as the collecting duct. The high calcium levels in the cavity of the collecting duct, again now it's going to bind to these receptors that's facing the cavity of the collecting duct. And binding of calcium to CSR in the collecting duct leads to the inhibition of the expression, the activity, as well as the trafficking of these very important water channels called aquaporin 2 water channels. So without these water channels, water cannot be reabsorbed from the collecting duct. So this means more water will be excreted, and that will lead to frequent urination and thirst. Another effect of hypercalcemia is that the higher the calcium concentration, the better the chances of calcium precipitation in tissues, calcification, and this can happen in the kidneys and cause tubular interstitial injury, and that can affect the concentrating ability of the kidney, resulting in frequent urination and thirst. So these are some of the major effects of hypercalcemia on the kidney that have been reported in scientific literature. So with this video, we have completed the discussion on hypercalcemia. In the next video, we will talk about hypocalcemia. So until the next video, once again, thank you very much for watching and supporting this channel. Have a wonderful day, and we'll hopefully see you soon.